Dr. Kyle with Project Wellness Company here. I just want to touch on something that we've had a lot of questions on recently. 2 weeks ago, the American Heart Association just released their new guidelines for blood pressure. Before Monday, the 13th of November, it was normal blood pressure if you were under 140 over 90. However, now the normal is 120 over 80. And right away, at first, I'll be completely honest. At first, I thought, great, they're just trying to get more people on medication. It's all funded by Big Pharma, and I have a push to get more people on medication. But the ingenious thing of what they did is they broke it down into categories. And I want to go over that with you real quick. Now, if you are over 120 to 129, it's actually elevated blood pressure. And they do not recommend medication at this point. They actually recommend lifestyle changes, dietary changes, where you're eating more fruits, vegetables, lean proteins, and not a lot of bad fats and high sugar foods. And this research actually shows by just doing that piece and doing it consistency, you're going to lower your blood pressure by about 11 points on average, which is huge. So now you're in that normal under 120 if you fall in that range. Now the other thing that they did is they took the 130 to 139 and they consider that high blood pressure. And even at that point, they're still going to recommend dietary changes and they're going to recommend lifestyle changes. And what I mean by that is eating properly, exercising, moving correctly, and allowing the body to actually function. Anything over that 140 over 90 is considered high blood pressure. And if you have a cardiovascular history where you've had an event, a family history of it, then they're going to be more likely to talk to you about medications, but as well, they're going to talk to you about lifestyle things. So the whole point of me bringing this up is, even though your blood pressure numbers may have changed where you fall in that category to where you could be at more high risk, it still comes down to the bottom line is you can personally affect that through eating properly, through exercising, through just getting off the couch and walking. Will allow you to live a healthier lifestyle and not have to fall into that category where now I'm on a medication for the rest of my life, which I don't know anybody I've talked to that wants to take a pill for the rest of their life. And ultimately, I look at it and I ask patients this every day, is the reason why your blood pressure is elevated because you have a lack of that drug in your system? I know, it sounds silly, right? But the truth of the matter is we got to address the cause. Why is it elevated in the first place? One of the ways that we do that in the office is we take a deeper look. And what I mean by that is we get a blood panel done where we're getting the LDLs, the HDLs, and not just the traditional model where it's LDLs and HDLs, but we actually look at the subparticles of the LDLs, where there's two different kinds of LDLs. One's like sand and one's like rocks. Okay, it's a lot easier to get the bad LDL out if we can identify what kind we have. And then on the same token, looking at the HDLs, there's 5 different kinds of HDLs. They're going to be the workers required to come and get rid of the bad cholesterols. So taking a dive deeper and looking at how the body's actually functioning so we can figure out what's causing those numbers to be elevated. Why is the blood pressure off? Why are the cholesterols, the triglycerides, why are those different pieces off? And a piece that I get often is, well, it's just my genetics. Mom and dad had heart disease, so now I have it. I'm going to have to take this pill the rest of my life. And the truth of the matter is if the genetic piece is there, which is that's something with new technology that we can actually measure and figure out, is if you have the genetic predisposition for heart disease. But the best research out there shows that if you have those genes, you're still at about a 25% chance to develop heart disease. So that leaves the other 75% of whether or not you're going to allow that to be built in your body. And what I mean by that is, analogy I like to use is, if you have the genetics for it, it's like walking around with a loaded gun. It's your choice with the other 75% of your lifestyle, of what you're eating, what you're exercising, how you're moving your body, as to whether or not you're going to pull that trigger. So that's something that we do within our office to dive deeper to see exactly what's causing the high blood pressure issues, what's causing the triglycerides, the cholesterol numbers to be off. So ultimately we can put together the best plan to get the body back functioning, because we want the body to function not only now, but for the rest of our life. So it's something that we do within our office. We run it through Boston Heart Lab. Super, super informative. It's by far the most complex report that you're ever going to have run in your life. So I would highly recommend it. If you fall into that category with the high blood pressure, or your numbers have now changed, you don't know what to do, let us take a look at it. Let's figure out what's causing the issues so that way we can properly address it through lifestyle changes, so that way you're not stuck on that medication for the rest of your life. and you actually get back your life as far as that goes. Because if you've known somebody that suffered from a heart attack or a stroke or something of that extent, the biggest piece that's affected is their quality of life. They're not able to do the things they used to be able to do because that took something away from them that they will never get back. So more information, give us a call at the office at 608-833-9445 or check us out on the web, allaboutchiropractic.com. Dr. Kyle with Project Wellness Company.